Hello, good day everyone. You're welcome to my YouTube channel, Pharmaco Healthy Channel. My name is Pharmacist Good Luck. In our previous presentation, we talked about the major reasons why people slump and die. In today's presentation, I have come to explain to us the necessary precautionary measures that we need to take to avoid slumping and dying one day. So we dive into the presentation proper from here, but before we do that, I suggest that we go for a little break. If this sounds so good to you, I advise you to stay tuned. Don't go anywhere because I'll be right back soon. Hello, you're welcome back to my YouTube channel. So the question now is, what are the necessary precautions that we need to take to reduce the chances of us slumping and dying one day? Okay, so number one is check your blood pressure regularly. It is very monumental not just to check your blood pressure regularly, but to do that according to specifications. The NHS has recommended that we check our blood pressure twice daily, and we should do that while sitting down, preferably in the morning and in the evening. They have also recommended that in addition to this, while checking the blood pressure, 2 different readings should be obtained with 1 minute interval between each reading. This is because the average value of these 2 readings gives a better blood pressure value when compared to just taking 1 single reading of our blood pressure. Additionally, the CDC has also recommended that while checking our blood pressure, we should maintain the same timing each day. Number 2 is check your cholesterol level. Yes, it is very monumental also that we check our cholesterol level. This is a test that is referred to as complete cholesterol test, lipid profile, or lipid panel. It is a test that basically checks the total quantity of cholesterol in our bloodstream, including lipids and fat. The basic parameters that are being measured in this test include the high density lipoproteins, the low density lipoproteins, the very low density lipoproteins, the triglyceride, and total cholesterol. Alright, the CDC has recommended that for every adult, it is necessary that the individual takes the lipid profile test at least once in every 2 to 6 years. However, for individuals that have family history of hypercholesterolemia or even other risk factors, it is necessary that they check their cholesterol level more often than just once in every 2 to 6 years. Now, I am asking you the question, when last did you check your blood cholesterol level? Have you even checked your blood cholesterol level before? If you have not done that, I advise you to go and check your blood cholesterol level. This is because hypercholesterolemia is a disorder that does not respect any profession. It can affect doctors, it can affect pharmacists, it can affect nurses, it can affect engineers, and mention them. Number 3 is check your blood glucose level. This is very important, especially for diabetic patients. This is because it enables them to identify and treat hypoglycemia, which when not managed properly can lead to unconsciousness, which can further be magnified into loss of life unexpectedly, a situation that we just discussed earlier, which is slump and die. Number 4 is go for your complete medical checkup. Yes, this is a test that is carried out to identify or to determine the overall health status of your body system. The test generally comprises of the liver function test, which generally states the health status of your liver, the kidney function test, which states the health status of your kidney, and a good number of other tests, which when combined together is now used to determine the overall health status of the individual. This test is very important, not just for individuals without any medical condition, but also for individuals with a good number of cardiovascular complications and other health challenges. Number 5, avoid stress. Yes, it is very important that you avoid stress. However, this is very challenging because stress cannot be completely avoided, especially for my fellow Nigerians, considering the economic status quo. However, the advice I have for you, if you are always exposed to extreme stress, is to consider taking a supplement that has been designed to take care of your stress symptoms, like stress defense. I am not in any way trying to promote this product. I am only trying to let you know that there are supplements that can actually relieve you from those your stress symptoms. So you can walk up to the pharmacy and request for any of these supplements so that you can start taking them in order to relieve you from your stress symptom. Additionally, ensure that you eat good food. Ensure also that you eat fruits and vegetables. Number 6, exercise your body regularly. Yes, the importance of exercise cannot be overemphasized. Exercise is very crucial to the body because it ensures that there is adequate flow of blood through the blood vessels to different organs of the system. It also enables obese individual to lose excess fat, which is a risk factor to cardiovascular complications and a good number of health challenges. When we talk about exercise here, we do not necessarily mean that you should go to the gym and start lifting heavy weights in an attempt to exercise your body. I mean, if you can do that, it is not out of place. But when we talk about exercise here, we simply mean those simple aerobic activities that you can engage yourself with. For example, just taking a walk is a very good exercise. Apart from that, skipping a rope and even trying other simple aerobic exercises. Now, having heard this, what is stopping you from going for an exercise? I ask you. Number 7, take your medication properly. Yes, it is very, very monumental that you take your medication appropriately. I know so many individuals do not really care, but the truth remains that if there is any health challenge associated with inappropriate take of medication, they are the ones that are going to suffer it. So I advise you to take your medication appropriately. Sometimes you have to bend down and ask yourself this question: this medication that my doctor have asked me to be taking on a daily basis, if I stop taking them, am I still on the right track? If the answer you got from this question is no, then my question is, why will you stop taking the medications? Now, I want to specifically advise you. You see those blood thinners that your doctors have recommended for you to be taking on a daily basis, don't joke with that medication. This is because it is the drug that will prevent blood from clotting in your blood vessel, which can lead to heart attack and stroke when not taken properly. So I advise you to take your medication properly. Number 2, you see this your antihypertensive drug that you are joking with. You take one, you don't take tomorrow, you take one the next day, you decide not to take again till in the next 2 weeks. These medications are designed to prevent excessively high blood pressure, which can lead to stroke. It can lead to other damages to your brain, to your eyes, to every part of your body when your blood pressure is extremely higher than normal. Then, number 8, avoid unhealthy lifestyle. This unhealthy lifestyle include smoking, snuffing, and then finally taking excessive alcohol. So at this point, I would like to say thank you for your audience. If you have not subscribed to my YouTube channel, you are not doing me a favor. Please, I beg you to subscribe to my YouTube channel. Don't also forget to like, comment, and share. Thank you for your audience and God bless you. See you in my next episode.